Let's visualize a conversation between a medium ticket patient and a dentist during the consultation or at the second stage of consultation after an investigation phase. Hi, patient. Hi, Mrs. Whatever the name is. This is the work you need to get done. I have analyzed your case. You have 4 root canals, 7 crowns, 3 restorations, and 1/3 molar extraction. And your total estimate is in the range of 30,000 rupees, depending upon the basic stuff that we discussed during the first consultation. डॉक्टर साहब, तो हम आपके पुराने पेशेंट हो गए हैं, अब तो आप हमारे लिए एक पैकेज बना दो, इकट्ठा सा बना दो जिसमें कि हमें ना फायदा हो जाए आपसे इतना सारा काम कराने का. Hi, I'm Dr. Bhavdeep Ahuja. I'm a dentist with 23 plus years of experience, and along with the dentistry, I'm training and coaching colleagues on the topics of practice management and medical legal consent documentation and finances in dentistry. So do you also face this problem every now and then? That patients asks you for a package deal for their treatment. This is one of the most common queries that I keep on getting in the WhatsApp community that I'm now running since 5.5 years now. So let me just share the query, how it looks like. So this is the query that I received. As most of us are new in private practice, again, one of the WhatsApp community members. So many advise us to give discounts or give package offer. Should we discriminate according to the area we practice? What is your take on it, sir? So I got back to colleague and asked him or her, who gives you this advice of discounts or giving the package offer? He said, sir, everyone gives it. Some of our family members, some of our relatives who are close to us or closely watching our clinic, sometimes even our seniors, sometimes our, you can say, colleagues where we interact with them in IDA, they give us this option. So what should you exactly do in such cases? See, my take is people who are beginners, they will feel suddenly too much on their plate when they start seeing such a case with 4 root canals, 7 crowns, 3 restorations, 1/3 molar extraction, and maybe miscellaneous profile X is also involved. So what exactly to do in such cases? Now, there are 3 types of reactions people will give. The beginners will have a man mein laddu phoota approach, the Cadbury ad that we all used to see. The middle road will start thinking, maybe react differently, maybe react in a manner, they'll be happy, they'll be sad, they'll be, you can say, sad about giving discounts and everything. And the settled ones, maybe 10 years plus, they'll have a different reaction. They'll, you can say, react angrily to it. What do you mean by this? Are you coming to a pan dukan? Are you coming to a sweet shop? Are you coming to this that you're offering discounts? So what is my take on it? Let me just share with you. So my take is, firstly, never fret or frown, never lose temper, because patients will always try their luck. Bargaining is part of Indian mentality. Whatever you do, people will still try that. You do go on to the next step of consent and, of course, written of your treatment approval form, or whichever way you are actually, you can say, signing on the dotted line, as we say in legal language. So whichever way you're finalizing, people will still try their luck in the end, but they always do so in a joking manner. So you always react, you also react in a fun way also. Some people will react in a serious manner, I mean the patients, where you can say the formula of S is equal to P minus E comes into reality. The S is equal to P minus E means satisfaction is equal to perception minus expectation. The patient has walked into your clinic with a certain amount of expectation. You give the treatment, and via your treatment and via internal acting ways, he sets up perception. Now, if the resulting P is plus and E is less, the S would be positive, satisfaction would be positive. But if the expectation is here and the perception formed is here, means what you did, the patient was not happy and satisfied. Again, we can go into the details. The patient is you can say, a perennial dukhi atma, as we call the customer is not customer, it is customer. So we need to remember that part. Now, because we don't have any metric, any gauge, any benchmark, any way to measure satisfaction, so perception minus expectation is the only way. So if the patient asks for a discount or a package at the end, and in a serious way, that means you have to understand that your P formed in the mind of the patient has been resultantly negative, which means naam bade darshan chote nikle aapke. So let's come back to the start. The patients will, you can say, you have given this plan total estimate roughly, let's assume 30,000 rupees plus minus 10% before you sign on the dotted line. You're just sharing the initial phase. You've not gone on to discuss the RBOs, risks, benefit, and options, and what are the inclusions, what are the exclusions. This is the basic estimate usually the patient asks. So when the patient says package bana do, deal bana do, please never fret or frown, never lose temper, react coolly to it. Don't get agitated or give stupid response. As I told you, ki pan dukan, mithai dukan, or whatever. This is dentistry. This is medical science. This is dental science. We are science based. We are evidence based. Don't go into that kind of logic. If the patient says coolly in a fun way, you also react in a fully in a fun way. Sorry, ये तो package वाला system यहाँ थोड़ा ना होता है, कहीं और ही होता है, यहाँ नहीं होता. So कहीं और होता है, कहाँ होता है, the patient will never ask that. So try to mitigate this thing in a very, very fun way. Then explain the things in terms of features, vis-a-vis the benefits. And this has to be done in a little serious manner. Of course, not in a too grim or a serious manner, just in a little or a serious manner where you actually tell the patient the benefits, that if they are coming for multiple things, if they're getting multiple things done, they are sorted out for the next 3, 4, 5 years, whatever you can say you put your benchmark on. I always put that if I am doing a full mouth kind of a FMK, full mouth kind of treatment, my patient should not need me for another 5 years, except the oral prophylaxis or the scaling part. My patient should not need me for another 5 years. And that is presuming that I follow up the patient, I give the patient proper instructions also, and I do other parts that which will help the patient in ensuring the longevity of the treatment. So explain the features wise, explain the benefits कि आप multiple visits में multiple काम करवा के या कम visits में multiple काम करवा के you're getting less of time wastage, less of petrol wastage. Actually, again, patient has said in a fun way, you also reply back in a fun way. Actually, you are getting the most benefits, so you should pay me more. In my earlier video, I have told this kind of an example when the patient asks, you have 6 restorations to be done. The patient says 5 + 1 free kar do. They say you are saving on time, you are saving on money, you are saving on appointment, you are saving on petrol or diesel, you are saving on everything. So you should pay me rather 6 + 1. I am doing a favor to you by saving all this on your part. So you started out with a serious note, started out with a fun note. Nahin, aisa nahi hota hai. Then you explain the features and benefits in a lightly serious manner, and then end that आपको बेनिफिट हो रहा है, आपको पैकेज की बजाय +10% मुझे देना चाहिए, मैं आपका देखो कितना कुछ बचा रहा हूं. The patient instantly gets this thing that yes, it is there. Remember, the patient is not going to leave you. You have to shun that insecurity from your mind that the patient is going to leave me if I don't give him or her a package. That is the biggest mistake you can do. If somebody has come to the package stage, that means they have placed their trust on you. So they consider themselves as your, they consider you as their primary dentist. So this problem happens more in smaller cities or tier 3 or tier 4 cities, but yes, sometimes in tier 2 as well. Mostly in tier 1, we don't come across, unless you can say clinic is in a suburban area, we don't come across such things. But yes, as I said at the start, people will still try their luck. Bargaining is a part of Indian mentality. It is a part of Indian mindset, and we should not be. It should not be something that should be taken to the heart. It should be something that should be taken as a normal stride and replied in a normal way. People will try their luck. Simply refuse them. Don't go unabashed. You can say criticizing these aspects, or you can say doing these things जो colleagues करते हैं, package बनाते हैं, they are stupid, they are unethical. Don't go on that. But as I said, backbiting is never going to help you in that sense. So you explain the patient that if you are getting benefited more, आपका सारा फायदा हो रहा है, तो फिर आपका फर्ज बनता है कि आप अपने डेंटिस्ट को ज्यादा पे करो. because he's saving you on a lot many things. He's giving you a follow-up also after 3 to 6 months or whatever your clinic's SOP, your clinic system is. So ask yourself, are you still willing to forego your profit? In my one of the previous write-ups in my WhatsApp community, I placed these things that we all work for passion and profit. Oh, sorry, passion and purpose. Passion, oh, I want to relieve the suffering of the patient. My purpose is to reach out, I'm sorry, to reach out to maximum people to solve this bigger passion of mine, bigger aspect of passion of mine. I want to do that. But passion and purpose need proficiency also. And if proficiency has to be, that means you have to be skillful. If you are skillful, you are confident of your skills, then you need to be persistent. Hold it on, never give it up. So these are the 4 P's: passion, purpose, proficiency, and persistence. But all these 4 will come to a naught if you don't have an approach of the 5th P, the profit approach. At the end of the day, dentistry is a business. If you don't want to see dentistry as a business, it is your choice. But it is a business because it has income and expenses involved. Of course, in the ethical way only. I'm not talking in an ethical way. So passion, purpose, proficiency, and persistence will come to a naught if there is no profit. And passion and purpose without profit will become poison, the 6th P. So it's your choice. What do you want? The 5th P or the 6th P? Profit or poison. So at the end of the day, it is all about what matters. So I hope you have liked this video and have something to carry home from this. If you did so, please do share with your colleagues, and please do subscribe to my channel. I keep on putting 1 video and 2 shorts every week. And I hope I'm able to send across the message to colleagues in this short video of mine. So bye-bye. Thank you. Take care until we meet again in the next video next Wednesday. Bye-bye.